Hi, I'm Tamara Renee with That Health.
I'm Faith. Nice to meet you.
Nice to meet you also, Faith. Thanks for coming. Tammy, you came to me for some conditions. I remember talking to you briefly over the phone and had you bring some paperwork that I sent to you. Remind me what you were plagued with or what you were challenged with?
I've had recurring yeast infections for quite a while, since the age of about 14 or 15, and I'm just very frustrated at this point. I've tried quite a few different over-the-counter remedies and delved a little bit into my diet, but I'd like to get to a point where I don't have to deal with it almost on a monthly basis, you know. So.
What actually caused the yeast infections to begin? Do you know that? Did you ever determine that?
Doctors have said it was because I got, well, they think I may have gotten a viral infection. I was sick for about 6 weeks, and they put me on 2 different forms of antibiotic. And ever since then, it seems like, you know, from what I remember, they started and were very severe, especially around that monthly time. They got pretty severe. So. Okay,
and did they ever explain to you why that happens? Why that happens when you're taking antibiotics, and why it could actually cause like a reoccurring yeast infection over time?
Well, it's just it affects the balance, you know.
The bacteria balance,
versus right.
Okay.
Right.
And did they ever talk with you about how your diet could possibly affect that?
Not at that time, no. Okay. I mean, I've read pieces, you know, bits and pieces here and there, just trying to find my own information, you know, and glean more alternative methods. But I know diet has a little bit to do with it.
So I'm going to just take a few moments here to look at the questions that the forms that you brought in filled out. And I noticed that you have heartburn issues. How often do you have heartburn?
Really depends on the types of food I eat, or I think maybe the times of day, or if I've gone a long period of time and I haven't eaten anything, and then I eat something and it just doesn't sit with me.
So Faith, looking at your forms here, I noticed that you have some other conditions going on. Do you feel that possibly the yeast infection was the most predominant and maybe had led to some of these others? Or do you see a disconnect between them?
I'm sure that one has something to do with the other, but because I developed the yeast infection so early, you know, that was what was prominent to me, because it was just very frustrating and recurring.